Human resource. The hospital in 2018 has a staff strength of 273. Of those, only 40 were appointed by the hospital and the rest posted by the Ministry of Health. Gender-wise, female constitute 67% of the overall staff. Clinical staff constitute 57.9%, which are nurses, doctors, midwives, medical doctors. And the skilled or trained staff was 110, that is 43.3%. That's not the report. Service delivery statistics. Outpatient attendance. The overall OPD attendance in 2017 was 97,699 compared to 93,043 in 2018. By age group, it was 32,369, 17,580, and 47,470 for under 5 to 14, and above 14 years respectively. That is for the year 2017. And for 2018, the attendance by proportion was 31.7%, 17.7%, and 50.6% for under 5 years, 5 to 14 years, and 15 years and above, respectively. Malaria cases. In 2017, of the 48,496 patients tested for malaria parasite, 3,721, that is 7.6%, were positive compared to the tested 50,972 in 2018, of which 2,779, that is 5.5%, were found to be positive. This indicates a malaria prevalence decrease by 2.1%. On malaria prevalence by age group, malaria positive test was 7% among people above 5 years compared to 0.7% among children below 5 years. This also alluded to the herd immunity that children have for malaria. That's science. The pattern was similar in 2018. For those above 5 years, the prevalence was 5.1%, and for those below 5 years, it was 0.4%. Bed distribution. In 2017, a total of 4,351 bed nets were distributed free of charge to patients. Of those, 2,299, that is 52.58%, were to children under 5 years, and 2,052, that is 47%, to pregnant women. Similarly, in 2018, a total of 3,711 bed nets were distributed. Of that, 1,893, that is 51%, were given to children under 5 years, and 1,818, 49%, to pregnant women. Dental services. A total of 6,045 dental cases were registered in 2017 compared to 7,018 in 2018, indicating a sustained increase in the 4 years we have just read. Between this 2017 and 2018, the increase was 16.1% in the number of dental conditions seen. Again, this points out to suboptimal dental hygiene in this country. Laboratory investigation. In 2017, a total of 6,719 tests. 719 tests were performed compared to a total of 86,495 in 2018, indicating an increase of 9,786, that is 12.8%, between 2017 and 2018. The various categories of laboratory investigation included hemoglobin analysis, hemoglobin estimation, urine analysis, blood grouping and cross-matching, and other biochemical tests. However, of the 48,487 malaria tests done in 2017, 7.7% were positive compared to 5.5% in 2018, again indicating a small reduction in the prevalence. In 2018, malaria investigation accounted for 58% of all the tests. Hemoglobin estimation 21 tests, urine analysis 10. And we have recorded 807 people who donated blood, with 819 people who received blood transfusion. In 2017, a total of 1,385 new cases of tuberculosis were diagnosed. Of those, 762 were males, while in 2018, a total of 465 were diagnosed with tuberculosis, indicating a reduction, significant reduction. While 26 of the patients with tuberculosis in 2017 were also infected with HIV, in 2018, the figure was 24. Antenatal care service. In 2018, a total of 4,385 pregnant women were registered compared to 4,915 in 2017. Put in another way, in 2017, 409 and 102 pregnant women were registered in a month and a week, respectively. Compared to in 2018, it was 365 per month and 91 per week. This statistics uncovers the high fertility rate in the Gambia. While antenatal care registration is near universal in this country, in that almost all pregnant women in this country register for antenatal care, it is worth mentioning that the majority of pregnant women register late, that is, after the first trimester of pregnancy. In this hospital, during the period under review, only 10.8% of the pregnant women register for antenatal services in the first 3 months of pregnancy. HIV prevalence among pregnant women in 2017 was 66, that is 1.4%, compared to 2% in 2018. This is consistent with the national prevalence rate study. Malaria prophylaxis during pregnancy. While 3,568, that is 73% of registered pregnant women received malaria prophylaxis in 2017, only 2,434, that is 55.5%, received malaria prophylaxis. This is because they register late. Male partner participation in maternity care. As alluded before, this practice is consistent with WHO call for male involvement and participation in reproductive and child health matters. In 2017, of the 4,917 registered pregnant women, 883 men, that is 18%, had their partner accompanied them at least once during routine antenatal care visits, while 24.5% of the women had their partner present during labor of delivery. In 2018, the statistics was 12% for men who accompany their wife for antenatal care, and for men who attended their wife's delivery, labor and delivery, was 22.6%. Now, deliveries. 4,483 women delivered at the hospital in 2017, giving a daily average delivery of 12 women. Of the 4 of these births in 2017, 97.5% of the births were alive, and 89.7% of the births were within normal range birth weight. Sadly, 4.5% of women were brought before they delivered before arrival. This also calls for the how do we manage access to healthcare in the urban area? We expect this not to happen in the urban area where communication is easy, but that's not the case always. 4.45% of the women deliver on their way to the hospital. In 2018, the total recorded deliveries was 4,473, a slight decrease by 10 compared to 2017. Of those, 97.6% were live births, and 85.2% of the babies weight was within normal range of equals to or above 2.5 kilograms. Overall, skilled birth attendant rate of the hospital was 89.2%. Importantly, in 2018, of the parturient women, 79.2% of the women reported for scheduled postpartum care. The cesarean section rate in 2017 and 2018 was 6.7% and 6.8% respectively. This is within the WHO approved parameter of between 5 to 15% of the catchment area. Referrals. A total of 445 out referrals were effected in 2017. And of those, 20.4% were women in labor, 5.2% were children, and the rest were general cases, compared to 577 in 2018. And of that, 20.4 were women in labor, 1% were children, and the other were general patients at the OPD. Inpatient admissions. The admissions in 2017 was 3,409, and in 2018 was 3,352. Immunization coverage. BCG coverage was 105%. The receipt for that is people who are not in a catchment area come for care, so they outstretch statistics. And in 2018, the BCG coverage was 98%. Penta 1 was 81% in 2017 and increased to 86% in 2018. Measles was 71%, but reduced to 63% in 2018. Drug revolving fund revenue. In 2017, the sum of $1,615,075 were collected as user fees, compared to $1,867,600 in 2018. Other matters. In 2017, a total of 329 surgical operations were performed, compared to 408 in 2018, giving an increase of 24%. Vitamin A supplementation was 18,060, but reduced to 15,587 in 2018. In the same vein, deworming of children reduced from 8,180 in 2017 to 4,815 in 2018. Birth registrations or birth certification in 2017 was 3,869 compared to 5,712 in 2018. In 2017, 3 maternal deaths were recorded, while in 2018 it was 2. Milestones. In 2017, on January 1st, the First Lady, through the Operation Save the Baby Foundation, provided gift to the first baby born in the year at the hospital ground. And also in the same year and the same month, the high dependency unit and the neonatal intensive care units were established. In March 2017, the hospital was renamed, not March, in May, the hospital was renamed from Jammeh Foundation for Peace Hospital to Bundung Maternal and Child Hospital. In June 2017, the ART Center, the Antiretroviral Treatment Center for HIV/AIDS, was established to provide care and support to people living with HIV/AIDS in our locality. In this July, Gambia for All Foundation donated 200 bed seats to the hospital. October 2017, daily clinical team morning meetings was introduced. On November 2017, the National Assembly Select Committee on Health visited the hospital. December 2017, the tuberculosis clinic was also established. And in the same month, a maternal and neonatal death review or audit was introduced. Year 2018. Again, on the 1st of January, traditionally, the First Lady, through the Fpac Foundation, provided gifts to first babies born for the year 2018. On January 8, a new hospital management board was inaugurated. 19 February 2018, a surgical camp was held. Maternal death review also held. On October 2018, a new 104 kVA package generator was installed as a backup electric supply. Achievements. The perceived quality of care offered at Bundung Maternal and Child Hospital among the general population is generally high, which is much appreciated. The statistics speak volume on that quality of care offered. 1. Live birth rate of 97.5% in 2017 and 97.6% in 2018 is the best in the country and comparable to none of the other hospitals in this country. Birth weight of above 2.5 kilograms is 89.7% in 2017 and 82.2% in 2018. Our cesarean section rate fall within the acceptable WHO parameters. Institutional maternal mortality ratio in 2017 was 47 per 100,000 live birth, and in 2018 was 45 per 100,000 live birth. Skilled birth attendance rate is 89%. Husband or partner presence during labor and delivery of their wife or partner is 24% in 2017 and 23% in 2018. Challenges. 1. Human resource. There was acute shortage of trained nurses and midwives. Workload is too much. WHO statistics tells us that a midwife is allowed to deliver up to 175 women per year. But in Bundung, we saw a midwife delivering over 300 women per year. Medical doctors, for example, anesthesiologists, neonatologists are not available at the hospital, even though we have a neonatal intensive care unit. Medicines, medical supplies, and equipment. Intermittent stock out of essential medicine, laboratory agents, and other medical supplies are not uncommon. Some of our biomedical equipment are obsolete. Transport. The current only ambulance is too old. I don't think these hospitals, particularly Bundung, they benefited from new cars. It's only used cars that they are given. If you want to bankrupt an institution, you give them an old car. 5.4, X-ray and mortuary services. There is no X-ray facility in the hospital warranting patient needing such services to be referred out. Equally and importantly, we don't have mortuary services. Space is a challenge. With only 6 delivery beds, often labor cases has to wait before having a delivery bed. Therefore, it is not uncommon that a woman delivers on the corridors. Postpartum ward, postnatal ward bed capacity is 14. And I told you we have 12 deliveries then per day. And it's the same ward that admits the antenatals. And the antenatal, you can admit in a day 6 patients. 6 plus 12 is 18, and you have 14 beds. Mathematically, there will be shortage. The available pediatric ward beds is also limited, and given the high influx of patients, it cannot cater for all. Financial matters, even with the workload this hospital do, with the highest patient burden, our subvention in terms of other charges is negligible. This is an important matter that needs to be addressed. You give a hospital for 270,000. They have to feed the patients, fuel the generator, and I must tell this August Assembly, the soccerways at the hospitals are smaller capacity than the hospital. The hospital was expanded, but forgot to expand soccerways. Every week, the soccerways are full. You spend 25,000 every week to empty them. Sundry for the hygiene of the hospital. Even with this challenge, our hospital is very clean. Hence, that attracts a lot of women far and wide to come for deliveries in Bundung. I also want to tell you that it's not only the people of Bundung constituency that come to deliver. I must tell you, only 17% of our deliveries fall within our immediate catchment area. 83% of the deliveries come all the way from outside, mostly from Pase, Pirkama, Nyomi, Farafenye, and the like. We should ask these women, why do they have to come to Bundung when there is a facility at their doorsteps? I thank you for your kind attention.
Thank you very much for ably presenting your financial statement and activity reports. That takes us to the end of the morning session, and we'll thank subject matter specialists, staffs of the National Audit Office, GPPA, the media, and all honorable members present. With that, I would like to ask any of the honorable members to move a motion that we adjourn until 1:30 in the afternoon. Yes, so the meeting stands adjourned until 1:30. But for Bundung Maternal and Child Hospital, we shall appear before the Fpac tomorrow, Tuesday, 17th October 2023 at 10 a.m. for consideration of the report presented this morning. Thank you very much.